Material in this video contains content included in the RBT Test Content Outline, 3rd edition, TCO. C.6 Implement Discrimination Training. Dana, a dedicated registered behavior technician, sat across from her 6-year-old client, Toby, in the therapy room at the ABA clinic. Toby, an energetic and curious child, was learning to discriminate between objects, and Dana was using discrimination training to teach him. Dana placed 2 flashcards on the table, one with a picture of an apple and the other with a banana. She looked at Toby and said, "Touch apple." Toby studied both cards for a moment and then pointed to the banana. Dana smiled and said, "Not quite. Let's try again." She repeated the instruction and used a gesture prompt by pointing toward the correct card with the picture of the apple. This time, Toby touched the apple. "Great job, Toby," Dana exclaimed, handing him a token for his token board as reinforcement. During the session, Dana continued presenting both cards while reinforcing Toby's correct responses to touch apple. When he selected the banana, he did not receive reinforcement. Over time, Toby responded correctly, touching the apple card more often when he heard the instruction, touch apple, and stopped choosing the banana. By the end of the session, Toby consistently picked the apple in response to Dana's instruction. With repeated practice and reinforcement, he was learning to respond accurately in the presence of the discriminative stimulus, the apple card, while reducing all other responses. This skill, called stimulus discrimination, would help Toby recognize and respond correctly to different words and objects, making it easier for him to ask for what he wants, follow classroom lessons, and participate in daily activities with more independence. Discrimination training in applied behavior analysis is a teaching procedure that helps clients learn to respond differently depending on the stimulus presented. It involves reinforcing a response in the presence of one stimulus, the discriminative stimulus or SD, while the same response is not reinforced in the presence of another stimulus, the S delta. Through this process, clients learn to label objects correctly, accurately follow specific instructions, and use words effectively when communicating. The goal of discrimination training is to teach clients to respond correctly to differences in their environment. The ability to discriminate allows clients to identify different objects by name, respond to verbal instructions accurately, and distinguish the difference between similar but different words or items. By learning these distinctions, clients can ask for what they need more effectively, engage with the people and opportunities presented in their lives at a deeper level, and participate in social situations in a way that is meaningful to them personally. Discrimination training is a key component of ABA because it helps clients develop essential skills needed for communication, learning, and independence. It teaches them to recognize and respond correctly to different words, objects, and social cues, helping them navigate real-world situations. For example, a child learning to discriminate between juice and milk can request the drink they actually want, reducing frustration. This skill, called stimulus discrimination, helps clients recognize and respond correctly to different words and objects, making it easier for them to ask for what they want, follow classroom lessons at school, and participate in daily activities at home and in the community with more independence.
Tailoring instruction to individual needs. Training should be designed to match the client's unique abilities, interests, and learning pace. Meaningful and evidence-based teaching strategies keep clients engaged and increase their chances of success. Adjustments should be made as needed to support progress while maintaining a positive and supportive learning experience. Promoting independence by fading prompts. Prompts should be used only when necessary and systematically faded to encourage independent responses. Over-reliance on prompts can interfere with skill mastery and limit generalization. The goal is to provide just enough support to guide learning, while reinforcing independent responding. Ensuring informed consent. Parents, caregivers, or the client must be fully informed about the training methods before implementation. Gaining consent ensures that interventions are ethical, appropriate, and align with the client's best interests. Open communication allows caregivers to provide feedback and collaborate in decision-making. Respecting dignity and autonomy. Clients must always have their choices, comfort, and personal boundaries respected during behavior analytic services. They should never be forced into situations that cause distress or discomfort, even when learning new skills. Encouraging autonomy allows clients to take an active role in their learning, fostering self-determination and self-advocacy. Using reinforcement ethically and effectively. Reinforcers should be appropriate, motivating, and beneficial without creating harm or dependence. Overuse of high-calorie edibles or highly intense rewards can lead to unhealthy habits or reduce long-term effectiveness. A variety of reinforcers, such as social praise, activities, and token systems, should be used to promote balanced and sustainable motivation.
Key takeaways for discrimination training. Definition and purpose. Discrimination training helps clients learn to respond differently based on each specific stimuli. Clients gain essential skills that help them navigate daily activities more effectively. Prompting and fading. Prompts, such as verbal, visual, or physical guidance, help clients learn new responses. These prompts must be systematically faded to encourage independent responding and prevent reliance on assistance. Gradual fading supports skill mastery and promotes long-term success. Reinforcement strategies. Effective reinforcement strengthens correct responses and increases motivation to learn. Strategies include positive reinforcement, differential reinforcement, and token systems to encourage skill retention. Using varied and meaningful reinforcers helps maintain client engagement and progress. Data collection and monitoring. Tracking progress ensures training is effective and that adjustments are made as needed. Data collection methods include trial-by-trial recording, accuracy percentages, and latency tracking. Regular monitoring helps identify trends, refine teaching strategies, and measure skill acquisition. Challenges and solutions. Clients may struggle with over-reliance on prompts, difficulty generalizing skills, or inconsistent responses. Addressing these challenges requires structured teaching, reinforcement, and varied practice in multiple settings. By using individualized strategies, RBTs can support long-term skill retention. Ethical considerations. Discrimination training must be respectful, individualized, and aligned with ethical guidelines. This includes ensuring informed consent, maintaining client dignity, and using appropriate reinforcement strategies. Ethical teaching practices help create a safe, supportive learning environment. Discrimination training is more than just teaching correct responses. It's about empowering clients to navigate their world with confidence and independence. As an RBT, your dedication to using effective prompting, reinforcement, and ethical practices makes a life-changing impact. By collecting data, overcoming challenges, and fostering generalization, you help clients unlock their full potential. Every small success is a step toward greater independence, and your patience, commitment, and passion make all the difference. The work you do is not just valuable, it is transformational. Keep striving, keep believing, and remember that every breakthrough starts with you. We appreciate you for truly making a difference in the lives of your clients.